Welcome to Global Agnikarma Center. My name is Vaidya Hitesh Chauhan and I am an Ayurvedic practitioner at Global Agnikarma Center. Today we are having one of our patients. He himself is an allopathic doctor. He is MBBS. He is 67 years old. Mr. Prahlad Bhai Thakkar, Dr. P.M. Thakkar. His age is 67, but as I know him since period of time, age is a number for him. He is very active and enthusiastic person, very positive towards life. He was here on 7th of October 2015, almost a year back, with severe back problem. He is here explaining his condition before Agnikarma, and he will be sharing his experiences, how Agnikarma changed his life. Hello Dr. Thakkar, how are you?
Fine.
Okay. When you came to us at Global Agnikarma Center, first session, on 7th of October 2015, am I right?
Yeah.
What was your problem at that time?
Actually, at that time, I was unable to stand, unable to walk without any support. I was always required help to stand and walk. That was the worst condition of my life when I was using a belt and a stick in my hand. And then I was able to walk a step, very slow steps.
Okay, then you have got back problem.
I had a severe back pain since last 3 months, before October last 3 months, since August 2015.
Okay.
And it happened suddenly. There is no history of injury or no history of any disease anywhere in the body.
It came suddenly.
Suddenly.
Okay.
So I consulted my doctor, orthopedic surgeon, and he advised me to take rest and some few drugs.
Okay.
And he assured me to become alright within 30 days, 4 to 6 weeks. But before that, I had got a severe pain on the back. And I again visited the doctor.
Okay.
And he examined me. He took another X-rays where the osteophytes were found, and the pain was because of that osteophytes, as he said.
Mm-hmm.
And then he just gave me the local block injections to relieve the immediate.
Local lumbar epidural was given.
Yes. And epidural injections.
Okay.
So I was admitted for a day in the hospital, his hospital, and he just did the procedure, and the pain was relieved immediately.
When was it given?
It was on the September 11th.
11 September 2015.
Yeah, 2015.
Okay.
And the pain was relieved, but the another conditions were not improving.
What conditions were not
Conditions when I was lying in the bed, I could not change my position. When I was go for the defecation, I cannot sit in the latrine, and I cannot take my bath properly. I cannot stand properly. I cannot wear my clothes properly. I have to sit down and then take my clothes. So that was difficult. No activities were possible for me.
Each and every movement
Yes.
was painful for you.
And my normal activities was restricted because of the disease.
Okay. Then what was the doctor's opinion?
Doctor
Then
said,
then you went to another doctor or another
no,
orthopedic
same
surgeon?
orthopedic surgeon treated me very well, but knowing his limitations, he told me that better you take the rest for at least 6 weeks. Lie down in the bed.
No activity at
No
all.
activity at all.
Okay.
And probably will not be able to continue your medical practice.
As I know you, you are a very active and enthusiastic
Yeah.
person to giving up your practice. What was your opinion on that? What was your feeling when doctor suggested that you have to give up your practice?
It was a shocking news for me.
Okay.
I cannot listen and I cannot think at that time to what will happen in future to me and to my family.
Okay.
Particularly when the complications of the prolapse spine, this is a PID, as in a short form told. PID's complications are very, very severe. Sometimes the paraplegia will happen, your urine defecation problem happens, and patient is bedridden, he cannot move at all. So they are the worst part of this complication of this disease.
Okay.
So I was afraid, and being a doctor, I know the complication. So I was afraid and praying to God to please let me have a good life.
I have his case form with me. He came here at Global Agnikarma Center on 7th of October 2015. He has given all his details regarding the symptoms, what was he suffering from, and the medical condition what he was having. I have his MRI report with me. The MRI report was taken on 11th of August 2015. The MRI report says there was L2, L3 and L3, L4 diffuse disc protrusion causing central canal narrowing, obliteration of right neural foramina and narrowing of left neural foramina resulting into compression over bilateral existing nerve roots, more right than the left. There was L4, L5 diffuse disc bulge causing obliteration of bilateral neural foramina and compression over bilateral exiting nerve roots. There was also L1, L2 and L5S1 disc level diffuse disc bulge with posterocentral and bilateral foraminal disc herniation causing indentation over anterior thecal sac, narrowing of bilateral neural foramina and compression over bilateral exiting nerve roots. Along with the MRI report, we have his MRI plate with us. As one can see in the plate, there is changes in total lumbar spine from L1 to L5. All disc bulge were there and they are creating the pressure over the nerve roots, and that was the problem that he was facing. And this MRI was taken on 11th of August 2015. Dr. Thakkar, as we have seen in the MRI, explained in the MRI about your disc bulges, the all L1 to L6, L5, all there was disc bulges and they were creating pressure on the nerve roots. With this kind of MRI, normally what is the prognosis? You can elaborate a little bit more.
See, prognosis is very bad. And for
You have gone to the doctor and the doctor's suggestion after seeing this MRI, what was that?
Actually, being a professional person, I can understand very well. The complication is very, very complicated. I mean, very dangerous in the sense, if you don't care properly or don't take the treatment properly, it may terminate into cauda equina. That is the highest complication which we have seen in this type of cases.
Okay.
And a person or a patient cannot work properly. Practically, he is a bad reader person. And as my treating doctor's opinion, he said, because you don't go out of your house, take the bed rest for many times, 3 months, 4 months, 5 months, and you just shut down your clinic.
That was the advice.
Yes, that was a pity on my patients, what they will do, where they will go. I have practiced in the last 40 years, and I am a doctor of poor patients, where the poor people will go. So I was shocked and disappointed, and that may terminate to in a depression sometimes.
Okay.
But I had controlled with the grace of God that I had not gone to the depression, but such a patient goes into the deep depression in their life. They are not able to recover at all.
How did you know about Global Agriculture Center?
Global Agriculture Center I had come to know from the sources of my patients, number one. And even though I was not affected because of that telling also, but at one good fine day, I got a newspaper, Gujarat Samachar, and I read an article on that Agriculture Center and Agriculture treatment. And then I was being a doctor and by a curious mind, and when other people had said that you are not going to recover from this allopathic treatment, so I thought in my mind, I talked to my person brain that let us go and see what they are doing. And out of curiosity, I contacted Agriculture Center. On the very first visit, I was so impressed with their approach to the patient and humility and their expertise. So I decided to take the treatment from the Agriculture Center.
We have his case history with me. He came here on 7th of October 2015. On the very same day, we examined his condition, seen the MRI, clinically examination was done, and on the very same day, we performed Agni Karma on his lumbar region, and after that, every week interval, we performed Agni Karma sessions for several weeks, and then we carry on with the treatment. With several sessions of Agni Karma, his condition started improving. Now we'll move on to Dr. Thakkar. What was the difference after Agni Karma? We started Agni Karma treatment on the very same day, on 7th of October.
Yes.
And what was your experience with the treatment? As the treatment continues, what was your feeling regarding the symptoms, regarding your disease condition?
Actually, in the beginning period, I could not make it different much.
Okay.
But as the time passes on, second visit, third visit, fourth visit, even though there was not much difference
Okay.
according to my own feeling. So I just presented to my doctor, Hitesh Bhai, sir, I'm not getting well as expected. So he said we will do something else to your case, and then he decided to do the deeper stimulation of the abdomen. And then after doing this another treatment, it's a part of Agni Karma, but different way. So I was relieving my pain and getting the result. So he called me not to come every week. Instead of that, I was called on every 21 days, and he was doing his job best way, in a best manner. And then gradually my pain was subsiding. Off and on, I was taking the painkillers as and when required, but it was taken very few, in a very few amount, less amount, and at a few times.
Okay.
So previously I was taking 3 times a day. Here, once in a 3 days, like that. So it has been reduced. I was able to stand, I was able to walk few steps, and then gradually after the completion of 4-5 sittings of 21 days interval, I got a lot of improvement.
Okay.
So sometimes I may use my stick and may forget my stick, so that was the condition for improvement.
Today is 29th of August 2016, and you have been under our treatment since 7th of October 2015. It's been a quite long time. We have performed several sessions of Agni Karma, then we followed the sessions on every 21 days, and since last 6 sessions we are following you, or we are performing Agni Karma on every month interval since
March.
Since March 2016.
60.
Since March 2016, we are following Agni Karma sessions on every month up to now. In this total treatment of Agni Karma, what do you feel? How many percentage you feel better?
See, after completion of the 21-day cycle, my spasm, my pain and disabilities from on the back side was gone gradually. So I was presenting my improvement picture. So my doctor, Hitesh Bhai, has told me to come at every month interval. So from March, I am coming on every month interval, and he's doing his job. He's giving me the treatment, and after that, gradually improvement is spike. It has come as a spike. I become totally alright. Nowadays, I am talking of today's incidents. I had came with my self-driving from Ahmedabad to Gandhinagar. It is 35 kilometers
Okay.
and heavy traffic road.
You have driven your car.
First time after 1.5 years.
Okay. That's good.
Yes. So I am very happy with this Agni Karma treatment, very happy with the doctors, other staff, and I have no words to, I am speechless.
You have mentioned earlier that you are having so much difficulty in your routine life with pain. Now explain about your routine life. What are the difference you are feeling?
In a few sentences I will tell that I was not able to wear my clothes independently.
Okay.
I had to take the help of my wife, my children, or I had to sit down on a chair, and after one by other, I was just, with the difficulty I was able to wear. Now there is no question about it. I am normal as usual. I was previously taking my all care, so today also I am taking my all care. I am attending my clinic, but
You started working.
yes, I am attending my clinic in the evening hours for 3 hours.
Okay.
I am attending my CMEs, which is my interest, in Sundays for 3, 4, 5 hours. I was sitting, I am able to sit, I am able to perform my routine work at home, at clinic, everything.
So everything becomes normal.
Yes, according to my own experience, I may say it is 100%.
It is 100% improvement.
Yeah.
If somebody asked you about Agni Karma treatment, what would you suggest? What would you say?
No question of suggestion. I had just taken the pamphlet from the Agricultural Center and put in my clinic, and I give the patient accordingly his need, and I canvas for it. There is no question, no doubt. Everybody will get all right in their specific problems, not all the problems of all the diseases, but wherever there is a pain, then I would say that you cannot change the pathology of the disease, but you can at least eliminate the pain. And pain is the biggest thing. You see the whole world suffering of the pain.
Yes.
Cancer pain, back pain, knee pain, shoulder pain. There is always pain, and patient is afraid of pain only. So if the Agni Karma can relieve the pain of the patient, there is everything to be done.
Yes.
This is a big thing to the humanity, to the patient. And I am very much appreciating and thankful to the Agni Karma Center that they have given me the second life, as I say. And I canvas for it. I just, in my other friends, doctor friends, non-doctor friends, patients, I always say to you, go, this is your problem, this will be solved there, don't worry, it's my responsibility.
So you are giving guarantee on behalf of us.
Yes.
Because of the treatment.
Because I got it. The result is in front. Result is in front.
Yes.
And I just pray to the God that they give you healthy and long life to serve the humanity.
Thank you.
And I just congratulate to Dr. Ashwin Bhai Barot with our Guruji, and he has promoted this Agni Karma process into the world. The people who are not knowing it, they should know, come forward. This is a beautiful thing. Everybody will get pain relief. Thanks.